Liver and portal vein. Segmental anatomy of liver. The liver is functionally divided into segments by three major and three minor fissures. The liver is functionally divided into segments by three major and three minor fissures. The theory of segmental anatomy of liver was proposed by Coinard. The theory of segmental anatomy of liver was proposed by Coinard. He used two structures, portal vein, hepatic vein, to identify these fissures. More portal vein than hepatic vein. He used two structures. Portal vein is more than hepatic vein to identify these fissures. Recently, researchers are using four structures for identification: portal vein, hepatic vein, bile duct, hepatic artery. Least important: portal vein, hepatic vein, bile duct, hepatic artery, little bit least important. Major fissures. Major fissures, the Coinard segments: right posterior section, right anterior section, right medial section, left lateral section. Right posterior section, right anterior section, right medial section, left lateral section. So in the diagram, this is right hepatic vein and this is the left middle hepatic vein, then left hepatic vein, portal vein and inferior vena cava. These are the hepatic veins: inferior vena cava, portal vein and gallbladder. Right lobe and left lobe, hepatic vein. This is falciform ligament and this is hepatic duct, gallbladder, and these two are bile ducts. Cantil's line or main fissure. Cantil's line or main fissure, imaginary line drawn from the groove of inferior vena cava to the fossa of gallbladder. Imaginary line drawn from the groove of inferior vena cava to the fossa of gallbladder is called Cantil's line or main fissure. Divides the liver into functional right lobe and functional left lobe. Functional right lobe and functional left lobe. Falciform ligament divides the functional left lobe into left lateral and left medial segments. Falciform ligament divides the functional left lobe into left lateral and left medial segments. Right fissure. Right fissure subdivides the functional right lobe into right anterior and right posterior segments. Right fissure subdivides the functional right lobe into right anterior and right posterior segments. Properties of right and left functional lobe. Properties: blood supply, right functional lobe, right branch of portal vein, right hepatic artery. Left branch of left functional lobe is getting from left branch of portal vein and left hepatic artery. Venous drainage. Venous drainage, right functional lobe, right hepatic vein to inferior vena cava. Left functional lobe, left hepatic vein to inferior vena cava. Bile drainage, right hepatic duct and left hepatic duct. Segments in right functional lobe. Fifth segment, right anterior inferior. Sixth segment, right posterior inferior. Seventh segment, right posterior superior. Eighth segment, right anterior superior. Fifth segment, right anterior inferior. Sixth segment, right posterior inferior. Seventh segment, right posterior superior. Eighth segment, right anterior superior. Segments in left functional lobe. Second segment, left lateral superior. Third segment, left lateral inferior. Fourth segment, left medial superior. 4A segment left medial superior, 4B segment left medial inferior. Planes of liver. Right part of the liver is having right posterior section, right anterior section. Left part of the liver, left medial section, left lateral section. This is the umbilical fissure or falciform ligament. We can say this is cantil line, right lobe and left lobe. Cantil line dividing the liver into right and left lobes. This is right and this is left. And the given segments 5, 6, 7, 8, 5, 6, 7, 8. Fifth segment, right anterior inferior. Fifth segment, right anterior inferior. Sixth segment, right posterior inferior. This is right posterior inferior. Seventh segment, right posterior superior. Right posterior superior. Eighth segment, right anterior superior. Right anterior superior. Next, left side, 2, 3, 4. Second segment, left lateral superior. The left lateral superior. Third segment, left lateral inferior. Left lateral inferior. 4A, left medial superior. 4A, left medial superior. 4B, left medial inferior. This is the umbilical fissure and this is cantil line which divides the liver into right and left lobes. So on the posterior side, 4B segment is quadrate lobe present between fissure for ligamentum teres and fossa of gallbladder, which belongs to left functional lobe. Segment 1, caudate lobe, independent segment present on the posterior surface of liver and blood supply, right portal vein and left portal vein, right and left hepatic artery, venous drainage directly to inferior vena cava, bile drainage left and right hepatic ducts. Ligaments of liver, falciform ligament, still-shaped peritoneal fold, extends from anterior abdominal wall to anterior surface of liver. Contain ligamentum teres, para-umbilical vein, falciform ligament on reaching superior portion of liver divides into two layers. Left triangular ligament, left side, superior layer of coronary ligament, right side. Coronary ligament connect bare area of liver to diaphragm. Bare area of liver also called as right extraperitoneal recess. So this is the bare area, proof for inferior vena cava, caudate lobe, inferior layer, right triangular ligament, superior layer of coronary ligament, left triangular ligament, fissure for ligament venosum. Boundaries of bare area of liver. Above, superior layer of coronary ligament. Above, superior layer of coronary ligament. Below, inferior layer of coronary ligament. Right side, right triangular ligament. Right side, right triangular ligament. Left side, left groove for IVC. Left side, groove for area is having left side groove for inferior vena cava. Upper, superior layer of coronary ligament. Below, inferior layer of coronary ligament. On right side, right triangular ligament, left side groove for inferior vena cava. Right triangular ligament. Next, right lateral surface of the liver to diaphragm, forms apex of bare area of liver, left triangular ligament. Connect upper surface of the left lobe of the liver to the diaphragm. The right side, it's continuous with left layer of falciform ligament. Left side, both layers lie close to each other and enclose the free margin. Two ligaments, remnants of fetal structure. Ligamentum teres hepatis, remnant of left umbilical vein. Ligamentum venosum, remnant of ductus venosus. Ligamentum venosum is remnant of ductus venosus. Connect left branch of the portal vein to inferior vena cava. Surfaces of liver. Superior surface related to diaphragm. Diaphragm is intertwining between lateral side lungs and pleura. In the middle, pericardium and heart. Anterior surface related to the xiphoid process and anterior abdominal wall. Right lateral surface divided into upper 1/3 lungs and pleura, middle 1/3 postodiaphragmatic recess, lower 1/3 10th and 11th rib. Relations of the surface of the liver, suprarenal impression, bare area, renal impression, and esophageal impression, gastric impression, pyloric impression, colic impression. This is duodenal impression. This is suprarenal impression. This is the bare area. Posterior surface, relations from right to left, bare area of liver, through of IVC, inferior vena cava. Fissure for ligamentum venosum, posterior surface, impression for esophagus. Inferior surface, relations from left to right, gastric impression, inferior surface to left lobe. Fissure for ligamentum teres, quadrate lobe, fossa of gallbladder, duodenal impression, upper part of the right side of the fossa of gallbladder, colic impression, lower part of the right side of fossa of gallbladder, renal impression, right side of the duodenal impression. So the portal vein, blood supply to liver 80%, 20% by hepatic artery, drains from entire gastrointestinal tract except lower part of anal canal. Carries blood from spleen, pancreas, gallbladder. No valves for portal vein. Behaves like an artery and gives out branches, left and right branches. Right branch, left branch. The sinusoids, they open the hepatic vein, then to the inferior vena cava. Portal vein is formed behind neck of pancreas at the level of L2, formed by the joining of superior mesenteric vein with the splenic vein. After formation, portal vein ascends behind first part of duodenum, enters right free margin of lesser omentum, reaches liver and divides into left and right branches. Portal vein is divided into three parts by duodenum: supraduodenal part, retroduodenal part, infraduodenal part. So this is the duodenum and this is portal vein, splenic vein. Relations of the portal vein. Infraduodenal part, anteriorly neck of pancreas, posteriorly inferior vena cava. Retroduodenal part, anteriorly first part of duodenum, posteriorly inferior vena cava. Supraduodenal part, anteriorly proper hepatic artery, common bile duct, posteriorly inferior vena cava. Tributaries of portal vein, splenic vein and superior mesenteric vein, right and left gastric vein, superior pancreaticoduodenal vein, cystic vein draining into right branch of portal vein, para-umbilical vein draining into left branch of portal vein. Portocaval anastomosis, lower end of esophagus, left gastric vein with aegaeus vein, portal obstruction like cirrhosis, collateral channels, distended and dilated, forms esophageal varices, and rupture leads to that hematomesis. Middle of anal canal, superior rectal vein with the middle and inferior rectal vein. Superior rectal vein with middle, inferior rectal vein. Enlargement of these venous radicals results in formation of hemorrhoids. Hemorrhoids above pectinate line, internal hemorrhoids, painless. Hemorrhoid below pectinate line, external hemorrhoids, more painful. Umbilicus, para-umbilical vein with superficial veins in the anterior abdominal wall. Portal obstruction, distended superficial veins around umbilicus, tortuous veins, caput, medusae. So that's it about the liver.